Hello everyone, welcome back to the channel. So today I'll be talking about prevention of diabetes. What can you do to prevent type 2 diabetes? So this is especially important if you have any risk factors for diabetes, as I already mentioned in my previous video. So if you have overweight or obesity, if you already have high blood pressure or high cholesterol, if you have polycystic ovarian disease, or if you had a history of gestational diabetes, or if you have a strong family history of diabetes, then you need to take steps immediately to try to prevent type 2 diabetes. And this is also especially important if you have been detected to have a pre-diabetes. So pre-diabetes is if your HbA1c, that is the average blood glucose level, was between the level of 5.7 to 6.4, or if you had a high fasting blood glucose, that is if your fasting blood glucose was between 100 to 125 milligrams per deciliter, then you are at an increased risk for developing type 2 diabetes in the next few years. And also pre-diabetes puts you at a high risk for developing cardiovascular complications. So what are these steps that you can take? So the first and foremost is the exercise. So exercise meaning what kind of exercise and how much you need to do to have some benefit in preventing diabetes mellitus. So it has been recommended that doing a moderate intensity exercise for at least 150 minutes per week, that is roughly around 30 minutes per day for at least 5 days in a week, will definitely help to prevent type 2 diabetes. So what is this moderate intensity exercise? How do you define it? So any exercise which increases your heart rate to 50 to 70% of your target heart rate. So target heart rate is nothing but it can be calculated from the formula 220 minus your age. So suppose you are your age is 40 years, your target heart rate is around 180. So any exercise which increases your heart rate to roughly around say 100 to 130 beats per minute, and you sustain it for at least 30 minutes per day for 5 days in a week, then you are doing a good job. So what are these moderate exercises? So just brisk walking at 5 to 6 kilometers per hour, or cycling at roughly 10 to 15 kilometers per hour, playing recreational sports like tennis or badminton, especially lighter activities like playing doubles in tennis or badminton, light dancing. So these are all examples of moderate intensity exercises. If you're doing more rigorous exercises, that is vigorous intensity exercise is something which gets your heart rate up to 80% of your target heart rate. So that can be like doing running at 8 to 10 kilometers per hour, or fast cycling, or playing active sports like tennis or badminton, playing singles, doing active level of swimming and aerobic dancing. So these are examples of vigorous intensity exercises. So if you're doing such exercises, then even doing 75 to 80 minutes per week is definitely beneficial. What does exercise do actually? How does it benefit? So regular exercise of this intensity improves your insulin sensitivity. That is, it improves the action of your insulin. It lowers your abdominal fat and it reduces inflammation. Another important measure is reducing your sitting time. So in a lot of recent studies, it has been conclusively shown that prolonged sitting is a significant risk factor for cardiovascular diseases and for the increase in your blood glucose level. So we recommend you to break up the prolonged sitting, whether it's in office or in home. So every 30 minutes to 1 hour, you should have a short break where you stand up and walk for some time for at least 5 to 10 minutes. And this has been shown in different studies to lower your blood glucose level and improve your overall cardiovascular health. So this is regarding exercise. So the next important step is making changes to your diet. So again, there is no any specific diet or any magic diet that you need to follow to prevent diabetes or improve your cardiovascular health. So it is important that you make changes to your diet in whatever you're eating, in whatever is your local eating patterns. So the first and foremost thing is reducing the consumption of added sugars. So whether it's white sugar, brown sugar, jaggery, or any foods with high sugars, this needs to be cut off from your regular diet, and this is one of the biggest interventions which will help you to reduce your blood glucose levels. It's also important to reduce the consumption of high amounts of refined and processed foods. You must include more whole grains, nuts, beans, and high amounts of fruits and vegetables in your daily diet. So following a diet which is similar to a DASH diet, that was a diet which was developed to prevent hypertension and to prevent cardiovascular mortality. So that is called as a dietary approach to stop hypertension. So in many trials, it has been shown to have a very good benefit in reducing diabetes and cardiovascular events. So this diet mainly includes taking high amounts of fruits and vegetables every day, and reducing your fat intake and reducing your sodium intake also. So it is important that you maintain an overall healthful eating pattern, and it's also very important to reduce your overall calorie intake. So this leads to the third important measure, that is to target a weight loss. And this is especially important if your BMI is more than 25, if you're overweight or obese, then weight loss is a very big factor in trying to prevent type 2 diabetes. So what do I mean by weight loss? How much weight loss you should target for, and how soon should you achieve this? So it has been shown that a weight loss of 7 to 10% of your body weight. So if you are around 80 kgs, then you must target a weight loss of up to 5 to 8 kgs. So achieving this weight loss and maintaining it over a period of time will definitely help to reduce your blood glucose levels. So how do you achieve weight loss? Well, of course, weight loss is a very complicated subject. I'll be making further videos in detail about the weight loss measures and diets. But the most important factor for targeting a weight loss is to reduce your overall calorie intake. So for the reducing your calorie intake, the first important measure is to estimate your calorie requirement. So your calorie requirement can be estimated through online calculators, which will use your age, your level of activity, whether you're active in your day-to-day life or you're sedentary or moderately active, and depending on your weight, you need to calculate your basal metabolic rate and the calorie requirement. So I'll give the link for a good calorie calculator below. So the important thing is to achieve a weight loss, as I mentioned above, to achieve a 7 to 10% loss of weight over a period of 3 to 6 months. You need to make sure that your calorie intake is at least 500 to 1000 calories below your calorie requirement. So if your calorie intake per day is at least 500 calories less than your requirement, so suppose your calorie requirement is around 1800, you need to reduce your intake to at least 1300 or 400 calories per day. This will help you to lose weight at a rate of 0.5 to 1 kg per week. And it is important that this should be sustained over a period of 6 months to 1 year. So if you again regain the weight, then again the benefit is lost. So these are the three most important measures which have been shown to have benefit in preventing diabetes. There have been studies regarding vitamin D, whether it can prevent type 2 diabetes, because vitamin D has been shown to have good benefit in improving your insulin sensitivity and improving the pancreatic beta cell function, that is function of the cells which produce insulin. But still, in most large-scale studies, there has not been any definite benefit to giving vitamin D, but it has shown some benefit in improving and delaying the onset of type 2 diabetes. And since vitamin D deficiency is very prevalent, it is okay to take vitamin D supplementation, but you must do this in consultation with your physician or endocrinologist. And when it comes to medication, only one medication called metformin has been shown to have a role in preventing type 2 diabetes. Trials involving most of the other medications have still not shown much definite benefit in preventing diabetes. So metformin may be prescribed by your physician or endocrinologist after looking at your risk factors, whether you had gestational diabetes, whether your BMI is high, or if your HbA1c is more than 6% and not responding to other interventions. Metformin may be prescribed to try to prevent type 2 diabetes, and if it has been prescribed, then you must take it. There is no harm in taking a metformin. So in conclusion, the main things that you should be focusing on is exercise, the right diet, and targeting weight loss. So you must start taking steps immediately to try to prevent type 2 diabetes. Hope you liked the video, and thanks for watching. I'll be back with another video soon. Thank you.